Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Welcome everyone for a special tip-episode. This episode/tip-episode might not so much be about a tip. It's going to be more about just something I just find fascinating and interesting. I met Renata on social media, as most of us dental professionals now meet each other. And her story has just like captivated my attention over the last several weeks. So Renata, welcome to the episode.
Thank you so much for having me. Hello, everybody.
First of all, just a quick little synopsis of kind of your background in dentistry.
So I became a registered dental hygienist in 2010. I'm in Savannah, Georgia, and I worked for 3 different practices pretty much my whole career. 1 year in pediatrics, and then pretty much just for one other office after that. So I was there for close to 10 years. So I was just one of those hygienists that I didn't do just hygiene. I did all the photos for the practice. I built the website. I organized all the HIPAA stuff, all the paperwork. I did a little bit of everything.
Were you asked to do all of that, or did you just volunteer? You're like, I love this stuff so much.
The practice that I worked for the most, they had 2 chairs when I started. And when I left, they had 10. So I was in the process with them as they were growing. And I am very hands-on, and I do love doing stuff and helping. So it was a mutual agreement.
No, I love it. I love it. So one thing that you're experiencing right now is you are doing palatal expansion as an adult. What I would like to do is maybe start this back for a few of us. I didn't actually learn about palatal expansion until many years into my career, which I kind of felt bad about, but really I don't think that that's all that abnormal. If you don't work in pediatrics, if you don't work in any sort of a surgical suite, you might not know that that's a thing that happens. So do you mind just kind of going through the process of like, why do people get, palatal expansion? Like what are the kind of indications for it? And then like your experiences with it.
Of course, traditionally, we only recommend somebody going to see an orthodontist if they have malocclusion, so if they have crooked teeth. Or we all are familiar with a posterior crossbite, when the upper maxillary teeth are kind of inside of the lower maxillary or lower mandibular molars in the back. But many people don't get that fixed when they're young, Mm-hmm. And now that I've been doing myofunctional therapy for 8 years or so, there's just this whole new world out there of looking at jaw growth, craniofacial development. How big are your jaws actually supposed to be? As a myofunctional therapist, we work with muscles. So we're working with the tongue function, position. And one of the main things is, where is your tongue supposed to stay? It's supposed to stay suctioned in the roof of your mouth, but you have to have enough room up there. So that's where palatal expansion comes in. So we start measuring. There are some dentists coming out saying, what kind of measurements we should be looking for, but that's how I got introduced to it. When I was 14, I did have a palatal expander just because I thought that people had, braces talked funny, and I wanted to have a lisp. So I asked my mom, can you please take me to the orthodontist because I want to be cool? And I got there, but my teeth were straight. So she said, you don't need braces, but we do, a device. I had no idea what it was. I did not understand exactly, but it made me talk funny. So I loved it.
Now, 14 is a little bit on the older side of getting this originally. When do they usually start looking for this in children?
So we can tell if a 2-year-old or a 3-year-old is going to need braces. Baby teeth are supposed to be like a picket fence, a tooth and a space, a tooth and a space. So we already know if they don't have any spaces on baby teeth, their jaws are already too small. There are many dentists out there right now, especially pediatric dentists, that are going into early intervention. So how can we help this child grow to their full potential? Because if they are already underdeveloped at 2 or 3 years old, it doesn't matter when they get to 12, 16, or 18, they're still going to be underdeveloped for that age.
Mm-hmm.
So there are things now that we can do. We can do some habit correctors. There are several different brands out there. Myofunctional therapy, of course, to correct the position of the tongue. Nasal breathing, those are going to help the jaws grow to its full potential. The pressure of the tongue on the palate actually drives the maxilla to grow forward and sideways. We call it transverse and AP. So there's a lot that we can do now in the beginning, but we always start with nasal hygiene. Another reason why all the jaws are shrinking, because people are mouth breathing way too much.
Mm-hmm. Yeah. So in your particular case, so you had it, but then it shrinks. It like you relapse. Like, what happened there?
Yes, that's the word, relapse. We all relapse. How many times have we seen patients that have had braces 2 or 3 times? Why? We never asked why, as dental hygienists. And I was one of those inquisitive children, and I'm always still like this. I feel like that's why I'm in the position that I am right now. But I wanted to know why. Why are people relapsing? So it's because we're not addressing the muscle. And I like to compare it to, if you go to a chiropractor, they're working on the skeletal structure. So they kind of, twist and turn and move the skeletal structure to the correct position. But why do you have to go back week after week? Because the muscle is not being addressed. If there's muscle dysfunction, meaning one muscle is not moving how it's supposed to be moving, your body is very smart. It's going to engage incorrect muscles to perform that function. The same thing is happening to the head and neck. What are functions that you do with the head and neck? So breathing, chewing, swallowing, speaking. If you can't do those correctly, and we have to do them all day long, we all do them. But if you're not doing them correctly, the incorrect muscles are going to engage, and then you might have issues. You might have TMJ pain. You might have headaches, neck aches, and things of that nature.
Were you a little bit nervous about getting the screws put in your palate again?
Extremely. I am the worst dental patient. I do not like getting dental work done. And then whenever you know that you're going to get anesthesia on the roof of your mouth, we all know that's the worst place.
Oh, yeah.
I was extremely nervous. And thankfully, I went to the best orthodontist in the country, Dr. Ilya Lipkin. He's in New Jersey. So I flew from Savannah to go see him. He's seen a few of my patients. But he does, I think it's the endo eyes. Oh, yeah. He uses that to freeze the area where the needle is going to go.
That's very smart.
It's genius.
It's very smart.
Yeah, so I didn't feel not even the anesthesia.
Tell us more about the procedure that they did for you.
So this is called the MARPE. It is maxillary expansion. It's not necessarily surgical because you don't have to be put to sleep. There are no cuts, but you are going through mucosa into bones. So it could be, seen as surgical depending on who you ask. Sure, but it's called the MARPE, and they do 4, 6, or 8 screws in your palate. And it's very interesting because, yes, they use it a drill, but they have to take impressions. You do a CBCT X-ray first, a 3D imaging to look at the size of everything, look at the thickness of your bone. And now they're so advanced that they will send that scan to a company who will place the screws digitally into the places where you have the most bone, where it's going to, be smarter. Back in the day, there are still some dentists that do the MSC, maxillary expansion, surgical expansion, I think it was called. Anyways, but the MSC is just the name of a device. Now, MARPE, they're all of these types of expanders, but they can be customized now. And this is how they do it. They do the CBCT, send it to a company. The company designs the MARPE based on what you look like. And then the dentist, the orthodontist in the office, I was awake. There were children next to me in the other chair. And he places those screws in your palate, and you leave the office already with this device. And it does hook to your molars. So you have bands around your molars, which make you have an open bite. I think that was the worst thing that I was not expecting. All of a sudden, my teeth are only in contact in one place where that metal is. And thankfully, I went ahead and started Invisalign on the lower. So it gave that metal a little bit of a cushion. So it didn't bother me so much. But when I had to take my Invisalign out to eat, it was super difficult because you don't have full occlusion, so your teeth are not touching at all. So like you can't chew salad. There are certain things that
Wow.
I was swallowing everything whole.
I bet. So you go through this process. How many weeks or months are you doing this?
So I got this installed on May 11th. A
Okay.
week later, May 17th, I started the turns. And you're supposed to turn. There's also many different providers out there. They will tell you to turn 3 to 4 times a day. Others say once a day. And new research is going to come out in the next 5 years. And the research is saying turn slow. Because as a child, whenever you get an expander there, as a child, your suture is still very malleable. So they put a rapid palatal expander, RPE, in your palate, and you have to turn super fast. That's because if you don't do that, it's going to actually move the teeth instead of moving the bone, the suture, opening the suture in the middle of the maxilla. Whenever you're an adult and they put this appliance actually in your jawbone, it's in your palate, it's embedded in bone. So you don't have to move fast. You're not going to move teeth. So I think within the next 5 years, 1 turn a week will be enough. But then it makes the process so much longer. So I've been doing this since May. It's September now. I should have been done already turning, but I slowed down a bunch after I've been talking to so many professionals and I learned this. We should be doing it a lot slower. But I think that I am done. I may turn 5 more times or not. I have to talk to my orthodontist. So the process now is Invisalign on the top, close the spaces. I'm not sure if they're going to have to do some composite to fill the empty areas. I think they usually do that behind the canine or behind the first premolar. And then, revisit what am I going to do after that? Are we going to do veneers or something like that, or just leave it alone?
So this is an audio podcast, so people can't see you, but you have obvious gaps now, which you didn't have before, right? In your anterior teeth. You also mentioned, though, that you've noticed some other kind of external facial changes. What were those?
Yes. Oh my gosh, my face looks so different now. So if you think about what the maxilla is a huge bone. It goes all the way underneath your eye socket, to the top of your mandible. It covers so much. Your nasal cavity is inside your maxilla. So every single time you're moving the maxilla, you're expanding the maxilla laterally. With the MARPE, it's also coming forward a little bit, maybe 2 millimeters or so. But it's moving everything else. So my cheekbones are so much higher. My upper lip looks beautiful. It literally looks like I got fillers because since the maxilla came forward a little bit, it's supporting my lip a little bit more. So it kind of has everted my upper lip where it looks fuller. It looks beautiful. I love it.
Nice.
My nose is wider. My eyes are a little bit wider. It's very interesting if you look at my before and afters.
That is interesting. That's something that I never would have thought of in a million years. I mean, we do know, I think from past episodes that we talked about, the shape of your nose is going to kind of widen and drop down just a little bit, right? But the rest of the cheekbones, all that stuff, you never really think about all this stuff. So Renata, you do a lot of things in dentistry. If someone wanted to reach out to you, if they wanted to follow you, learn more about myofunctional therapy, whatever, where can they reach out to you at?
Of course. So social media, I am all over social media all day long. I have 2 main Instagram accounts. One of them is Myo Moves, MYO Moves. That's my myofunctional therapy practice. I see all my patients online. And then I also have Airway Circle. We're on Facebook and Instagram. So if you'd like to learn more of how to become a myofunctional therapist, we have something called Myo University, where we offer some courses from beginning to end to get a dental hygienist from leaving the dental office, starting their myofunctional therapy career, all the way to how to start a business, and tons of support and an advanced course.
Thank you so much for all that you do, and thank you for being on the show.
Of course. Thank you for having me.
A tale of 2 hygienists.